high-risk strains for the HPV, for the cancer cervix, can be done easily on this platform. So we plan to include the HPV DNA. Other thing which we want to start very soon, we are in the process of validation of these tests like HPV DNA. Second, CTNG. CTNG is Chlamydia trachomatis Neisseria gonorrhoeae. So this is a combined test for that, which can detect those things. Hepatitis B viral load, because I know that in counties HIV viral load is free. TB Gene Expert is free, but hepatitis B viral load is not free unless you get a sponsorship from some program. CTNG is not free. So please refer these cases to us. We will try to see how we can help your patients, because we are not here to do business. We are here to serve the society and have a symbiotic relationship with the counties. Other things that we want to start in the coming months, I would say, is HIV viral load. Next gen sequencing, which is not available in any government hospital as of now in Kenya, and cytogenetics, that is also not available in any government hospital of Kenya. Histology and cytology samples we are processing right now in-house. So the gentleman which is seated here is a histotechnologist by profession and also our lab supervisor, Mr. Edward Ochieng. So we do histologies in-house. This is our grossing station. He is the one who is grossing it. Cytologies, pap smears, and FNAs, bone marrows, all the things we are doing it here. We are a fully automated lab in that. As you can see, the tissue processor, the tissue processing is not manual. We are using an automated tissue processor and also a slide stainer for that. This is our ethos, that is think quality. Quality improvement is a never-ending process. Also to let you know that this lab is going for ISO accreditation from KENAS by September. So we will be accredited by KENAS by September, and we will be ISO 15189 2022, the latest version, what the laboratory standards say, not 2012. This is our team, which is working relentlessly to serve the community. And I would like to end by saying that great leaders start off as great followers. So we are following the bigger institutions, but one day we want to be a great leader ourselves. Thank you for that.
Thank you very much, Dr. Rao. From my point of view as an infectious disease specialist, it's very important to have a good lab, because basically otherwise you just do everything clinical. Okay, so I don't need a machine or something like that, but I need a good lab, and I'm really happy that Jalaram has really excellent lab. So until now, Catherine comes up and talks about the whole scope of the machine. I would like to know who enjoyed the food. Lunch? One only? Okay. So let's clap a hand for her, because she's the sponsor, or she's the leader.
You have a presentation after this. You have a presentation after this? Okay. So I need to keep it. Yeah.
All right. Good afternoon. Oh, sorry. I forgot the online streaming. I just plug it, that's it. Oh, my shirt is too... Okay. How's that? This is okay? I hope. Where's the speaker? This one. Oh. Oh. All right. Now we're in the digital era. So everything that is happening on location needs to also happen wherever the other audience are, right? Are you guys excited? Mumeshiba. Did you eat well? Are you full? It was hot, chilly. Yes, I know. I agree with you, but it was sumptuous all the same. So my name is Catherine Mwangangi. I think we've not met face-to-face with any of the team members here because we engage a lot in the county level, the sub-county level, up to the healthcare center level. But I do try my best to partner with our other hospitals outside of what is happening in the government or public facilities, the counties and the national, the referral hospitals. So I've worked with Cefaid for 2 years, 6 months, but generally I've been in the field for around 7 years. So I'm excited to meet with you today. And we really talked about why we are here, to understand what is happening in this facility. And it's amazing because in Kenya, we have about 323 gene expert instruments, and Jalaram is one of them. Imagine that. Bringing the highest quality diagnostics near to the patient, near to that patient who possibly cannot be able to walk into Aga Khan and access the same services. So whatever is happening in Aga Khan is also happening here in Jalaram. So we encourage you to keep on sending your referral samples here. And we're excited, we are ready to answer your questions because we will work very closely with Dr. Yvonne. So my presentation will be short. I wanted us to make a quiz, but I didn't get enough time because I usually like quizzing so that we know if we are understanding, if we are in sync. But then I also want to say, you professionals sitting here may know more than me. I've not spent a lot of time in the hospital, just a little bit, or in patient face-to-face. Maybe that was not what was in my heart. So I decided to come to the other side of things. So I'll take you through maybe a slide each of these topics. Maybe it will be more of an interaction. So we'll talk about what's happening, what are the healthcare challenges that you are facing when you're treating your patients or when you're seeing your patients, what innovations are there in TB diagnosis, and what innovations are there in virology, which I know the facility intends to introduce. And then I'll talk generally about the disease coverage. I liked the gentleman who talked about how to handle that gene expert cartridge. Is he still here? Yes. It means he has worked with this machine and he really understands what is required. And I'll show you a short video about what he was talking about, the chambers and all that, so that by the time we leave here, we know what we are going to take back to our facilities when they are collecting the sample and when they are transporting it to the nearest gene expert site, for example, this one. So there are many healthcare challenges, and most of the challenges are the ones listed on this side. Sometimes you're in a healthcare facility where you're trying to deal with so many different suppliers, you're trying to get a test for this, a reagent for the other, but the good thing with the gene expert is everything happens inside the cartridge. In fact, we call the cartridge, it's like you're carrying a lab inside there. You have the extraction inside there. You have the amplification inside there. So it's like carrying a lab inside a cartridge. Then most of the time, the other methods have longer turnaround time. It takes too long. You tell your patient, you go come back. We'll give you the results when they come back from the reference site. But now, at least when you send it to Jalaram, I hear most of us are from here, Westlands, Kangemi. Within the day, you should be able to get your results, or that patient should be able to get their results. Then we have limited flexibility in other solutions. And here we are saying the gene expert can run up to 625 tests in an 8-hour day, because each module, and I'll show you what I'm talking about, the modules and all that. So it means each module is able to test at least 6 tests in an 8-hour, 6 TB tests in an 8-hour working day. So as I go along, you will appreciate that different tests have different number of minutes that it takes to run if you've interacted with the machine before. Then it allows us to decentralize. You're able to go near the patient. I'm so impressed to hear that, was it Kangemi? I had Westlands, that you know that the first test to do for a TB patient is the gene expert test. So I'm really excited to hear that. And this is feedback I'll take back to my seniors. I mean, we are having an impact to very near patient facilities. So there are many challenges, and you can see the way gene expert fits into fixing those challenges. So as I had alluded, we have different types of GeneXpert machines. I know the most common one you see is this one, right? If you've ever, how many have seen a GeneXpert machine? Anybody else? Okay, you? Wengine hatujaona. You've not seen a GeneXpert machine before. So this is the way it looks like. And most of our public facilities, when you're referring your samples, they have this type of instrument. And on your desk, I put in some brochure that shows you the picture much closer. So when I talk about a module, this is what I mean, this slot. You see where this cartridge has been placed? This is one module. This is another module, another one, and another one. So this is a 4-module machine. This is a 2-module, and then 16. Then we have very big machines, one called an Infinity that has up to 80 slots or modules. Now the beauty about GeneXpert is all the modules work independently. Meaning you can load a TB cartridge here, and maybe this one has gone out for repair, but doesn't prevent this one from working. So it means you're reducing the downtime. And that's the good thing about the GeneXpert. You don't have to wait for the engineer to come and replace the module so that you can continue. You can run with whatever is on. So that means the turnaround time, we are able to keep it much closer than other conventional platforms. And the gentleman who has just stepped out, I remember he said it is very simple. It is just 3 steps. Just 3, imagine. You just collect the patient's sputum sample into that sputum collection bottle, which we don't provide, but I think they are usually commonly available. Then inside the box that comes with the cartridges are 10 cartridges. A cartridge looks like this one, and I'll show you a video. Then it comes with 10 pipettes. So 10 cartridges, 10 pipettes. Then there's also a dilution solution, a small reagent just inside the box. So you just aliquot the sputum, you mix it, then you put it inside the cartridge. I'll show a video and I think it will make sense. So once you put the reconstituted sample inside the cartridge, you load the cartridge, you close, you select the test, then you walk away. You go and do other things. After 80 minutes, the test is out. It's easy for reading. By way of example, this one was running a HPV test. You can see how it's giving an example of how the test would come out. So it is just 3 steps, meaning any person at any healthcare level can do it. I'm not trying to get rid of the lab techs, but let's say a patient has come, the lab tech maybe is on off, there's no other lab tech, even you can do it. It is just as simple as that. You can run the test, 80 minutes later, the test is ready. I'll show you a short video now. I just hope my sound won't let me down because I think it's important for us to get to see. Let me first duplicate my screen. Yep. Let's see if the sound will work. Oh, the sound is not working. Okay. But let me just explain as the video plays. So that's the way the cartridge looks like. Those are the components, the base, the top part, and the, what you call the cage, if you may. Then it has beads inside. These are the reaction beads, the white ones that you see. So you put the sample inside. Once you've reconstituted it, you load it into the GeneXpert machine. You close the door. You select your test, what test you're doing. So now the reaction starts. The extraction. So there's a rotating action happening at the base of the cartridge. So it draws out the sample, rotates again, mixes the sample with extracts the DNA. Then it rotates again, aliquots that, pushes it into the reaction chamber, it rotates again, mixes now the different reagents. All this is happening inside the cartridge, inside the machine. So it now does the amplification. So all this is all the components of the cartridge that are inside the cartridge that are mixing together. So it rotates again. Then now goes to the reaction chamber to keep on amplifying the extracted materials. Oh, okay. Then the test is ready. You dispose it, and then you wait for the results to come out. So that's what's happening inside the chamber of the cartridge. If the sound was there, I think we would have had an easier time, but it's okay. So going back to the presentation, that's as simple as it is. Now let's look at what else can the gene expert do, because in fact, when I get calls from hospitals, they tell me, do you have those kits for gene expert? Do you have those kits for gene expert? So I start wondering, what do you mean, those kits for gene expert? Gene expert can do more than 30 types of tests. TB is just one of them, okay? TB is just one of them. So we are divided into different portfolios, and note that each test is an individual cartridge. So you get a cartridge for MRSA, you get a cartridge for TB, for HPV, and so on. So under the healthcare associated infections, I think these are some of the tests we are discussing with Dr. Yvonne to introduce here. Under the healthcare associated infections, I think most of these are for facilities that already have a critical care facility or ICU or HDU. Respiratory diseases is where we thrive the most, because that is where tuberculosis, the cartridge lies. And on top of that, we also have a multi-drug resistant cartridge. So once you get a RIF positive patient, you don't have to take them for culture. You don't have to wait another 3 days. You just reflex test on the MTB XDR. You get INH, you get the second line injectables and the fluoroquinolones. You're able to get all that from one test cartridge, and I'll show you maybe more on that. Viral load, hepatitis B. I know you'll use your immunoassay to get to know if the patient is positive for hepatitis B. Then now you can use the nucleic amplification test for monitoring if they are responding to the medications that they've been put on. Hepatitis C can be used to diagnose and to also monitor the patient. Then of course, HIV viral load for your infants, and also that's qualitative for your infants, and then normal viral load to monitor your HIV patients. Now that you have a CCC, I think it becomes key as well. For your sexual health, chlamydia, gonorrhea, Mycoplasma genitalium, though I've not seen much of guidelines in this country on this. Trichomonas vaginalis, human papilloma virus, which we talked about. Group B streptococcus for our antenatal mothers, though the guidelines in this country have not yet seen a proper way of how to manage our pregnant mothers once they come to the antenatal clinic for that organism. Then we have our more high-end tests. So we have the bladder cancer detection and monitoring kit, the breast cancer as well, CML, that chronic myeloid leukemia, that's BCR-ABL. Then we have factor 2, factor 5, the coagulation factors. Unfortunately, we have had to discontinue enterovirus. And for Ebola virus, we are improving on the already existing test because we have many strains of Ebola. And currently ours will only detect the Zaire strain. It won't detect the Sudan and the ones that are coming up in our borders, especially the border between Kenya and Uganda. So the next time you call your referral site and ask for a gene expert, no, you're not asking for the test, you're asking for the machine. So I want gene expert TB, I want gene expert HBV, I want gene expert HIV viral load. So this is how powerful Jalaram has decided to power itself, by ensuring that you can get results within the shortest turnaround time for any of these disease areas. So I think I won't dwell too much on this. We know the MTB RIF Ultra test uses, and the on-label sample type is the unprocessed sputum samples or concentrated sediments. I know Dr. Yvonne talked about the CSF. Some of your public facilities even do with stool, but that's off-label use. But then again, if you've done it and validated it in your own lab, then it is your decision. But ideally, we only recommend it for unprocessed sputum samples or concentrated sediments. As I mentioned earlier, this test takes about 80 minutes. And remember to, as you meet your patient, get to know they are not on any, they've not been on any anti-tuberculosis medication or less than 3 days of therapy in the last 6 months. So, because they could be reinfected again. So as I said earlier, we have the reflex test of MTB RIF Ultra. So if you get a RIF positive patient, you can reflex test on this. So you take the same sample that you had tested that patient if you had stored it. If not, probably you'll have to collect a fresh one. Then you prepare it and put it in the cartridge. It goes through the process. Then it gives you if there's isoniazide resistance or not, in which region, the cartridge region and so on. Then it gives you the drugs now, ethionomide, fluoroquinolones, the second line injectables, as I had said. The reflex test can be reflexed from the MTB RIF Ultra cartridge, or if you had already started the culture process, you can get a sample from the midget culture and put it inside the cartridge. So it informs also what patterns you're seeing. So we have many algorithms, but most of the WHO drug-resistant guidelines help us, or they tell us to more or less follow the easiest route. So you get your patient, 80 minutes you test, you get maybe MTB susceptible. So it could be INH or multi-drug resistant TB. So you reflex test on the XDR, you initiate or optimize the treatment as per the guidelines. As opposed to going for the culture way, which will take about 4 to 6 weeks for the patient to get treated. Once you reflex test, it takes another extra, only 90 minutes. So the algorithms could be different. Here I just wanted to show you what else we have more specifically. So I talked about the HIV qualitative for your infants, HCV finger stick, HIV qual extended coverage. This is actually live now. I know we had said July 2021, but we had some few delays, but now it is available. XC, because it has extended coverage. It has another region of the gene that it is detecting. So it used to detect the LTR region, but now we added the POL region as well. I don't mean to get too sciencey, but basically it is an improved version of the test. So you can send your patient to get their viral loads monitored, and only 91 minutes, the test is out. 105 minutes for HCV, the test is out. HBV, 1 hour, the test is out, it's ready. So you don't have to wait the way you used to wait, weeks, months, even some results don't even come back. Some patients don't even want to come back to get their results. So the gene expert eliminates that loss to follow up, which is a concern for the clinician, because things like TB, they go back into the community, they spread it. Okay, so you want that patient to come to be tested and everything is done. Then I want to take a trajectory into HPV. I know Dr. Yvonne talked about what they're offering here, but you as clinicians, look at what the algorithm is. So when you're screening, you're either doing testing, which is using the VIA and also confirming with the HPV DNA. So it's up to how the facility has, or which algorithm the facility has decided to go with. what is recommended by the WHO right now is go direct to testing the patient with a nucleic amplification, with an ART test. Basically a gene expert HPV test, go direct. Because the visual inspection is subjective. It depends on the experience of the nurse, you know, the patients that they see, what they see, it is subjective. But HPV NAT test is accurate. By the time that patient is leaving, you're giving them what they need to do next. Do they need to come back again for a colposcopy? What do they, a thermal ablation, what do they need to do next if they have HPV 16, 18, 45, which are the most prevalent genotypes in our population? I'm not disputing that the other 11 high-risk genes could be there, but then in our population, from the various studies that we've done in Kenya, mostly in Kenya and Uganda, and generally in sub-Saharan Africa, we find that 16, 18, and 45 are the ones that are occurring in our population the most. So the other 11 high-risk types are 31, 33, 35, so on and so forth. So when you use the Gene Expert HPV test, it will call out independently 16, 18, 45. But the other 11 high-risk types will just be reported as detected. So you won't know if it is 31, if it is 35, but at least the most that are in our population will be called out, because this helps you as a clinician to know that, okay, fine, I found a HPV 16, 18, or 45. Then it means this patient has a higher likelihood of developing cervical cancer. So, or those cells, maybe not the cancer itself, but the cells. So now what do you do? Are you sending them for colposcopy, or what are you doing? So in 56 minutes, you're able to get that result. And we are not stopping there. This is my last slide. We are not stopping there. We have other tests that are in development. And let me see the one that is likely to be ready soon. So of course we've had delays because when COVID came, we were not able to do R&D and produce many more tests. So the multiplex vaginal panel is almost ready for market. The acute myeloid leukemia is almost ready for market as well. The others are still in development, but it shows you that we are not just on the 30. We are also developing other tests to run on the Gene Expert. So the future of Gene Expert, even here in Jalaram, is very bright. So let's keep referring those samples. I think that was my last slide. This one was just FYI on us, but I think that is not so important for today. I'm available if you need more support, more guidance, any questions. I know the health centers usually say, why am I just taking so long? Now Jalaram is here. They don't need to take long.
Thank you very much, Catherine. I am preparing for my second talk. I would like to welcome all the newcomers in the room and also shortly introduce myself again and what we have missed. So my name is Dr. Yvonne. I'm the infectious disease specialist here at Jalaram. You find my business card on your table. Please really use me. I still have a lot of capacity in my clinic. Send patients to me when you want to have a second opinion, a review of patients. You're really free to do that. The consultation is for free. And if you want to send somebody to go around the lab, you're also welcome to do that. We have our gene expert machine, the 4-chamber one. So far, we only test for TB. The test is 5,500. If you want to have patients or like to have a discount or even for free, please send them first to me, as we have discussed. Maybe also quickly introduce yourself because you came in later. Who are you? Your name? Yeah. From Kagame as well. There's a lot of people from Kagame. Okay. And you? I just do a second introduction round. I'm Dr. Yvonne. I'm the infectious disease specialist in this clinic. And you are